Okay, so welcome everybody to this webinar. It's a pleasure to welcome you. My name is Samantha Holloway and I'm the Programme Director for the Masters in Wound Healing. I shall just put my colleague on screen so she can introduce herself as well.
Hi, I'm Sian Edney. I'm a lecturer on the course. I also work across programmes and I'm 2 days a week with wound healing. So yes, hi, nice to meet you.
Okay, so I have popped in the chat. It would be nice to know who's joined us today and where you're from if you do have access to the chat. Perhaps you could put that in there. And we do also have the Q&A area too. So you're welcome to pop any questions that you may have. And perhaps I'll ask Sian to keep an eye on the questions for me in there. So I'm just going to we can move people on and off screen. So I've just put Sian off screen for the moment. And I'm just going to share my own screen and just check with Sian that she can see my presentation okay. And that, so I have to pop in the screen. There we have got presentation on screen, hopefully. And just going to put it into slideshow. So Sian, could you let me know if you can see my slides okay?
Yes, I can see them.
Good. Okay. Great. As I say, Sian, if you could keep an eye on the chat and the Q&A, if that's okay, because I don't see anybody now. All right. Well, it's a lovely sunny day here in South Wales at the moment, and I think the picture on the first slide shows that too. So the Masters in Wound Healing and Tissue Repair is based in the School of Medicine at Cardiff University. The university has two main campuses, the one in the main city centre and the School of Medicine campus, which is based at the Heath Park. So that's just there for you to see. I mean, essentially, we're an online distance learning course, so you don't actually come to Cardiff, but perhaps it's just nice to know where we are and where we're based. So I just wanted to let you know a little bit about the programme and where we've come from, if you like. So the Masters in Wound Healing and Tissue Repair is one of the original the original master's program that was set up actually in 1996 as a postgraduate diploma. And then over a period of years, it's developed into a master's program. And that was from 2004. And from 2020 onwards, we've been an online e-learning program. So that's to say we have a number of decades of a good history behind us in terms of providing master's level programs, but also online masters as well. So this just summarises the programme structure for you. It's a 3-year part-time programme. And in part 1, which is years 1 and 2, you will undertake 6 modules. So in year 1, there are 3 modules that you can see listed there. So the first module, we cover biology and psychology of wound healing. That module runs over 10 weeks, and that's followed by the research and quality improvement design and methodology module, which again runs for 10 weeks. And year 1 finishes with the healing dynamics, influencing factors and diagnostic assessment module. So you follow those modules in turn, starting with biology, then research, and then the healing dynamics, as I say. So the modules start in September, October time, and usually by April, May time in year 1, you finish those 3 modules. And there's a break for the summer before returning to year 2, where you undertake 3 modules in year 2. So you can see there's the management of acute wounds, management of chronic wounds, and values and priorities. So that completes year 2, which again starts in the September and finishes in around the April-May time of the following year. So that's the first 2 years. Then year 3 is the dissertation year. So it's a full 12-month dissertation, and that's 20,000 words. So collectively, that gives you your 3 years of study. So we're delighted to celebrate students who have completed the master's programme. This chart here essentially shows you our graduates from the beginning of when we were at master's up until July of last year. And you'll see that there are more MSc graduates than there are postgrad diploma and postgrad certificates. So just to explain that, it is a master's programme that students sign up for, but you can exit after a year with a postgrad certificate or after 2 years with a postgraduate diploma. So hence why we have a lot more MSc awards, because essentially that's the target award that students are aiming for. But it's just to be aware, you can exit after 1 year or 2 years with an award as well. So what do our students or our graduates say about undertaking study with us? We've undertaken a number of surveys, one of which was published here, looking at the impact of postgraduate studies, not only from the Masters in Wound Healing, but also other courses within the School of Medicine at postgraduate level. So the impact is essentially that the evidence suggests that postgraduate study is important. Our students reported they had an increased sense of confidence in their ability, better understanding of speciality related evidence, and also could relate what they've learned to clinical practice. So, it is the impact is important and is positive from the results we've got from the surveys we've undertaken. So just to come back to the master's programme itself, I'm just going to take you through an example now from September of last year. Obviously, the dates are September 25 rather than 26, but the dates you need for 2026 are on Course Finder. But I just want to show you an example of what the learning looks like if you were to choose to study with us. So once you're registered as a student, you will get access to the Cardiff intranet, which is shown in the picture on the left there. And essentially that gives you access to all the resources you'll need, such as email, OneDrive, Learning Central, which is where you get your module resources, the library, and lots of other things as well. And then on the right, you see what we called is Learning Central, and that's essentially Blackboard, which is the learning management system that we use across the university. So that's where you access all of your materials once you're registered as a student. So what we do is we have an induction week, an online induction week. We will provide you with more details of this if once you've applied or planning to apply, or if you need to know more information specifically, then we can provide that sooner rather than later. But during the September induction week, there'll be a program activities running each day. So essentially, each day we run one activity, but we repeat that 3 times. And that's because we have students in different time zones. It is an international program. So we try and accommodate for different time zones and allow students to choose when they'd like to attend one of the sessions. So you don't have to attend 3 sessions per day. I just wanted to stress that it'll be one session per day, ideally. So on the first day, we do a welcome to the programme. You meet the programme team, we give you an overview of the programme, and you get to meet some of the other students that are on the programme as well. So generally, those sessions run in the morning, the afternoon, and in the evening as well. They're generally about an hour and a half long, can be less sometimes, depending on the number of students that log in. And those sessions are recorded. So none of these sessions are mandatory. We do suggest you do try and attend the sessions because you will gain from being there live, but we do record them so you can access these sessions afterwards should you need to. On the second day of the induction week, we run a workshop, which is a guide to your online resources. So we take you through logging in and where to find everything and making sure you have access to everything that you need. And again, you see that we offer 3 sessions in the day, So you're welcome to log in to whichever session you want to. Excuse me. And actually, you can log into more sessions if you want, but we do repeat the information, but you might get to meet different people in each session. So that's the welcome and then the workshop. Then we have a online library induction session with our librarian. That usually happens on the Wednesday of the induction week. And there are 2 sessions offered that day, morning and late afternoon. And our librarian, Marianne Hillier, would take you through everything you need to know about accessing your library resources, making sure you have all the software you might need, where to download things if you need them as well. Then on the Thursday of the induction week, we have a study skills session. So we work through through things like academic writing, referencing, academic integrity, and those sessions are repeated. And then the Friday of the induction week finishes with a session. Excuse me, I'm just going to have a drink. A session dedicated to the first module and what you can expect of that first module. So we take you through the learning resources, the assessments, and again, where to find everything. So by the end of that 5-day induction week, you should have a good overall sense of how you're, going to go about your studying and also what you need to do. And remember, the sessions are recorded should you not be able to attend. So just to recap on the year 1 and 2 modules, this table outlines the 6 modules that you can see there, remembering that the first 3 are in year 1 and the second 3 are the year 2 modules. You can see that they each run over 10 weeks. So once you've completed the biology and psychology of wound healing module, on the day you submit the coursework and assessments for that module is the day the next module starts. So we run them in sequence. You can see the number of hours there, and the number of hours equates to the number of credits. So essentially 200 hours is a 20 credit module. Those 200 hours are made up of things like online lectures, tutorials, self-directed study, and also planning and writing the assessments as well. And we'll come back to what a module timetable might look like shortly. So just an overview of the biology and psychology of wound healing, which, as I say, is your first module. So we're looking to not only provide you with the theoretical underpinning of wound healing, but also looking at the psychology of wound healing as well. So you look at the normal response to tissue injury, looking at different phases of healing, how we study wound healing in terms of in vivo and in vitro models, and then we look at research on the psychology of wound healing, looking at evaluating an area of health psychology of interest to you, and then looking at different psychological approaches to help individuals cope with a non-healing wound. So in terms of the content, you can see there some of the things that we cover. This isn't an extensive list. There's many more things in the module. I've just picked out some of the main areas of the content. Now, we provide the content for you as learning materials that you access on the module. So that's usually via what we call a workbook, which is split up into different sections that has activities for you to do to enhance your learning. And there are lectures that are associated with most of the content. We don't have lectures for absolutely everything. We pick and choose what we think is of particular interest, where our areas of expertise lie, and also where we have guest lecturers that can come in and speak to you about their areas of research and interest as well. So I just wanted to give you an overview of what a module might look like for you in terms of how you'll use that 10 weeks of studying. So this is an example from last year. What we do is we plan a module timetable for each module that sets out over the 10 weeks what you can expect to learn. And we will provide online lectures as well as online tutorials, discussion sessions. It may be a mixture of those. So this is an example, as I say, which I'll just talk you through. So this is looking at the biology, first of all, the biology of wound healing. And so we have a number of honorary title holders that are essentially guest lecturers for this programme, often key experts in the field. So for example, Professor Stephen Percival runs his own research laboratory looking at biofilms actually, but has a real interest and expertise in wound healing as well. So he would be one of the lecturers that would be talking to you about normal wound healing. And then we also have one of our doctors and graduates who's based in Malaysia to talk about specifically matrix metalloproteinases and their role in wound healing. And then we intersperse the lectures with tutorials with either myself or my colleague, Sian, as I mentioned. So whilst the lectures will take place just once in a day, those are recorded. The tutorials we are able to provide at different times of the day to accommodate different time zones. So you can log in to whichever session for the tutorials that you feel you can manage. Then, so again, the timetable looking at normal oxygen in wound healing. So, a particular expert, Dr. Edma Woodmansey, contributes to that. We also then have somebody who talks about different models in wound healing, and then also looking at things like skin barrier and microbiome. So these are a mixture of live lectures. They may be pre-recorded lectures that you watch before you attend the session, and then you get to discuss the topic area with the particular expert. So it's a little bit of a mixture, and it's quite nice to have that variation, I think, rather than always having pre-recordings that you have to watch and then you attend a Q&A. There is that mixture which allows you a whole hour sometimes to discuss a particular area of wound healing with one of the subject experts. So it's a model that's worked for us quite well in providing that variety. And then again, you see you get another set of tutorials before then, in this instance, kind of the psychology of wound healing then starts. So we have experts who are based in Australia, also Portugal. You can see they're talking about aspects of health literacy and behaviour change. Then we have topics around stress, anxiety, and psychological theories related to wound healing, again interspersed with tutorials with my colleague Sian. And then looking at some primary research and ethnographic work that's been done by one of our colleagues in the School of Business, as well as looking at application of theories. So, for example, looking at motivational interviewing and how that can be used to support individuals with wounds. So we're coming towards the end of this 10-week module as an example that I'm showing you. And so you'll notice here that we do provide an opportunity for you to submit a draft piece of coursework. So that draft piece of coursework you'll get formative feedback on in order to then make any necessary adjustments before the final submission. So that's for the coursework. And then the other assessment we have for this module is a presentation. I'll come on to that in a minute to give you the more details. But we do have a formative assessment for the presentations where we allow students to present their work. It's not marked, but we give it feedback at that point prior to the final submission. So you do get good opportunity for feedback on both the coursework and the presentation before you have to submit at the end of the module. And you can see there we keep a tutorial slot just before submission deadlines for any last minute questions or queries. So I mentioned for the first module, there's a piece of coursework and a presentation. So the coursework is a 3,000 word assignment. We're marking it in terms of different domains. So you can see that we're marking it on knowledge and understanding of a topic area, analysis and evaluation, synthesis and critical thinking, and then also communication skills and conforming to instructions. And each of those four domains within the assignment are then weighted, as you can see the weightings, the percentages there. Then the presentation is around about 1,000 words or 15 minutes. And you can see there that we've got the other domains that we're marking against the presentation. So they're marking different domains of academic and information literacy, creativity, originality, imagination, professional values and behaviours, and then communication skills and conforming to instructions. So overall, in terms of the percentage weighting of the coursework and the presentation, the coursework is weighted at 70% of the module mark and the presentation is weighted at 30%. And that's an example of the coursework brief that we gave the students for this year, combining last year, the biology and the psychology aspects of wound healing. And we spend quite a bit of time talking through what the requirements are for the coursework and giving you help with planning the coursework and answering any queries you may have. And then the presentation for this first module is you choose a psychological approach and then present on that. But as I say, we give you lots of help in planning what it is you want to do. So I'm just going to run through the other modules in year one now. So the second module which you do, which starts in the January of each year, so you do get a break for Christmas. That's the other bit of good news. You finish the biology and psychology module towards the beginning of December, and then the next module doesn't start till the January. So there's a good 3-week break there. So yes, in this module, we're looking at research, design and methodology, as well as quality improvement as well. So I won't read everything out on screen there. On Course Finder, you'll actually find some of this information as well if you want to go back to it. But essentially, we want students to have an understanding of qualitative, quantitative and mixed methods research. We do look at statistical concepts as well. But we also bring in the role of quality improvement approaches such as clinical audit and service evaluation because they're particularly important in the healthcare service as well. So hopefully by the end of the module you'll have reached those outcomes. And in terms of content, then we look at things like the hierarchies of evidence, principles of research, principles of quality improvement, aspects of methodology around sampling, data collection, data analysis, and that's leading towards critical appraisal of evidence. So we look at critiquing frameworks. How do you then also use reporting guidelines to support assessment of the quality of a study or a piece of evidence? And we also look at things around ethics and considerations for research and quality improvement as well. So for that module, there's a piece of coursework, which is a 3,000 word assignment. Similar to that first module, you can see that we're assessing the four domains and they're weighted as shown there. For that assignment, we give you a specific study that we ask you to critique in depth. There's also a presentation, and the presentation again is the domains we talked about before, and the weighting is 70% weighting for the coursework and 30% for the presentation. So as I mentioned, the coursework, we will choose a study that will give you a recent study, could be qualitative or quantitative, and we ask you to provide an in-depth critique using the appropriate reporting guideline and also following a framework for critiquing. For the presentation, you focus on a quality improvement approach, and you get to choose a published a published project that could be a clinical audit or service evaluation. And again, you would undertake an evaluation of the methodology of that specific quality improvement project. So the final module in year one is what we call healing dynamics, and that combines looking at factors affecting healing, so intrinsic and extrinsic factors affecting healing, but also then diagnostic assessment. So assessment and measurement tools that we use in wound healing to help us decide on a diagnosis for that patient. So we call that clinimetrics, that aspect of measurement. Clinical measurements is called clinimetrics. So just to give you an overview in terms of learning outcomes, you can see there that we look at intrinsic, extrinsic, local and systemic factors. You'll get an opportunity to choose one of the factors to focus on for the coursework. And then we also look at the principles of not only clinimetrics, so clinical measurements, but also psychological measurements, so psychometrics. And you'll get an opportunity to explore the literature in that area. We also look at things like Winter's concept of moist wound healing and the development of dressings over the last sort of 60 years or so. So we really go back to the seminal literature in this area, and you get a chance to think about dressings, devices, in terms of how they've developed and how they can help to support patients with wounds. So you should be able to then integrate knowledge of assessment and diagnostic techniques in terms of patients with factors affecting healing. So in terms of content, what do we cover? Well, lots of things. Not only, as I mentioned, wound dressings, moist wound healing, but wound assessment, thinking about measurement of blood flow, looking at impact of diabetes on wound healing, infection, but also then how do we assess infection, how do we assess bioburden, pain, nutritional status, looking at different classification systems, not only for diabetic foot ulcers, but for pressure ulcers, pressure injuries. And we also look at those psychometric assessment tools. So quality of life assessment and health related quality of life tools are also covered. So for this module, there are two pieces of coursework. One piece of coursework is a 3,000 word assignment, and the other piece of coursework is 1,000 words. And they're weighted at 70% for coursework 1 and 30% for coursework 2. And for coursework 1, this is split into two parts. And in the first part, you choose a factor that affects healing. So that could be intrinsic, extrinsic, local, systemic, any factor that you choose. And look at the evidence and research around how that factor affects wound healing. And for the second part of that 3,000 word assignment, you then choose the relevant assessment or measurement tool for that factor and discuss then the clinimetrics or psychometrics of that assessment measurement tool. Again, I'm sure I mentioned for the second module, but for all modules, the opportunity to submit a draft piece of coursework 2 weeks before the final deadline. And then for coursework 2, for this last module in year 1, you get to focus on principles of moist wound healing and get to explore some of the assessment frameworks that have been developed based on moisture being an important factor that does affect wound healing. So we look at the research underpinning frameworks such as timers, time CDSD, which is T, which essentially combine the concepts of wound bed preparation. And so you'll evaluate how these concepts have influenced clinical practice. So that completes year one. You have to obviously have to pass each module, and then you can progress to year two. So in year two, so if things don't go to plan, you're allowed a resit attempt for each module should you need to. And that resit period runs between June and July of each year. And then year two starts for this year, starts on the 21st of September 2026. Obviously, if you start this year in year one, that will be a 2027 date. And again, we have an induction week. So we have an induction week for year two, similar to that I showed you of year one. And in year two, you have 3 modules, as I've already mentioned. So you get to look at surgical trauma and burns injuries in that first module. In the second module, you can look at pressure ulcers, leg ulcers, diabetic foot ulcers. And in the last module, it's based around healthcare service provision. So to progress to part 2, which is the dissertation stage, these are dates as if you were starting last year, if you like. So these wouldn't be dates for you if you started this year, but it gives you an idea of the sequence of events that you have to follow. So you have to pass all 6 modules in part 1, so that's years 1 and 2, in order to progress to dissertation. The dissertation module starts in early October of the year that you're due to start the dissertation. So if you started the year 1 this year, it would be 2028 that you'd be starting dissertation. And then completion date is 12 months after that. And then usually the results follow the following year with the graduation in that 4th year afterwards. Appreciate it may be a little bit confusing showing those dates here, but I can clarify any questions you might have about that. So with that kind of brings me to the end of the presentation part. So diolch, thank you for listening, and I will stop sharing my screen and bring both Sian and I on screen to see if there's any questions or queries that's come in to the chat.
There's nothing in the chat so far.
Nothing? Okay. And no Q&A just yet either. Okay. So we do still have, I think, 2 attendees watching us. So, Sian, is there anything you would like to add as advice or guidance to anybody thinking about doing the program?
Good question. You've done quite a comprehensive presentation there, Sam, as well, I think. Yeah, so I guess ask us questions if you have them, really. Yeah, in terms of advice for joining us, it's quite based on individual circumstances as well, I think, on what people are interested in. So it'd be interesting to hear the backgrounds of our 2 viewers and why they're interested in applying to the course.
Yeah, thanks, Sian. That's a good point. And on that, I guess I should say, we do have different healthcare professions that study the program. So the majority tend to be nurses, and nurses not just from the UK, but from Europe and further afield. They may be nurses who are already in the world of tissue viability or working as clinical nurse specialists who are seeking to undertake a master's in the related area. But we also have nurses who want to progress into tissue viability as a speciality. So they may be working in surgical, emergency medicine, emergency departments, but want to get the theoretical underpinning. So undertake the master's program in order to get that evidence-based practice behind them. Um, we also have podiatrists, and we have a number of podiatrists each year. Generally, it's probably about one third podiatry colleagues, I would say. And again, these may be podiatrists who have just qualified or have been working in the area for a little while. And I know the podiatry field is changing in that, there are podiatrists focusing on at-risk limbs or foot, the feet are particularly at risk. So we do have podiatrists working in that area. And then the other group of professionals that we have are usually doctors, so medical doctors, often international, based overseas, working as maybe medical officers in a speciality field of wound healing, or actually working as physicians or medical GPs as well. So that would be the other area. We do also have colleagues from industry, so they may be working as clinical nurse educators or clinical nurse specialists, working for one of the big dressings or device companies, or maybe working in research and development for a company, or working in sales and marketing as well. So we do have colleagues from industry that undertake the program as well. But we do welcome applications from other professions. So we'd love to see some pharmacists, for example, because they are often the ones advising on dressings and prescribing and giving patient education and information. Um, Physiotherapists or physical therapists. So in some countries, physiotherapists take the lead on wound care, particularly actually in the US. So I know that physical therapy colleagues there actually undertake a lot of patient care for individuals with wounds. Um, so we have had a few physiotherapists, but we always welcome more. Um, and I know Shana and I have been talking. We'd love for some general practitioners to do the program as well, because they're often the ones that patients are going to with any sorts of wound healing problems. So that kind of gives us an idea of the professions. So you'd be joining an interprofessional program, and our students do give us feedback about learning from each other, Sian, don't they? I think as well, sort of that multidisciplinary approach.
Yeah, they do, definitely. And I think it makes for really interesting discussion in the tutorials and in the discussion groups as well. Everybody has varied experiences that then they can bring in. Particularly, some are more biology based for the first module, they've got more biology background, and some have more of a, psychology sort of interest, and sometimes they haven't done much psychology either. So yeah, we have really interesting discussions between the different professions as well.
Yeah, yeah. And I think the other thing I'd like to, and I mentioned a few times about the flexibility of the program. So, we are able to provide quite a lot of support. And in terms of tutorial, you will have noticed from the example timetable I showed that we offer tutorials at different time zones, so students can choose to log in, when it is appropriate and um, when it's okay for them. So there is that flexibility around that. Um, and I think what we've also found is that the students build quite a nice community, building on that kind of multidisciplinary approach. There's often an informal community that builds, often through somebody setting up a WhatsApp group, but they then provide students can provide peer support to each other outside of the scheduled timetabled sessions. Um, and that's quite a nice way of keeping in touch, because we appreciate if you've not studied online or at a distance before, it may well be quite daunting. And so you might feel, well, is it going to be quite lonely? How much support and contact time can I expect? So I think you can see from what I've presented, we try to have weekly contact points through live lectures, discussions, tutorials. Students can also ask for more one-to-one support as well. And you do get allocated a personal tutor that supports you throughout your programme. So they are there to provide academic and pastoral support as well. And often act really as a signposting to other university resources as well. Um, Sian, I wonder if it's worth mentioning in terms of other types of support we provide. You sit on the neurodiversity group, don't you, for the universities? So I just wondered if you want to just mention perhaps some of the support or some of the things you're doing to help support students with, well, and staff actually, isn't it,
Yeah,
with
students and staff.
neurodiversity?
Yeah, so I'm lead on the neurodiversity and inclusivity, easy for me to say, steering group and network, which is also a part of the disabled staff network as well as dipping into the disabled students network. We mostly work with research postgraduates as well. But yeah, we have consultations on how best to approach change within the university. What's going well, what could go a little better, and what do we need to focus on each year. So I tend to know what's going on for support between these areas, what sort of training we can put in place. Yeah, so and I'm glad Sam mentioned the personal tutors. That you have a personal tutor for pastoral support. So if you think that you have additional needs that you need support with, or consider yourself to have a disability, we do have disabled student services, which you can access as a student for extra support, or if you need reasonable adjustments. And there's lots of online training as well. We have a lot of support on this course on the initial first week, where we do a lot of scaffolding, really, to help develop your skills around critical appraisals and help set expectations for what the coursework entails at master's level, because sometimes there's a bit of a leap. And then from that, we can have a discussion as a personal tutor about what needs you may have, signpost you if you needed to, and support you with building those skills throughout the course. But yeah, and myself and Sam are the personal tutors for this course as well. So, and Sam is senior personal tutor for the graduate course, so you're in good hands.
Thanks, Sean, and thanks also to one of our attendees that's watching. And apologies, the chat's not available. I do apologise for that, but I can see the Q&A is. So thanks, David. I'll answer your query in a minute. So if anyone else is tuned in and listening, please do use the Q&A as the chat area as well. So David, I'm delighted to know that you're starting this year. That's good to hear. And you've asked a really important question about recommendations of reading or books before the course starts. So Sian and I also sit on what we call the Welcome to Cardiff group, and that's a group of postgraduate colleagues that have been working probably for the last at least 3 to 4 years now on a set of resources that we will provide before the programmes start. So those are things like study skills, tutorials. So for those who may not studied for a while, we provide that. We provide information on sort of academic writing, also a little bit more on personal tutoring. So that would come to you once you've accepted your offer and firmly accepted your offer, around about 6 weeks before the programme starts, we would send out that information. And in fact, there's no reason why we can't send that sooner if you would like that. Specifically for the programme, we do have a set of what we call pre-course reading and books that we suggest. Now, that's not to say you have to go out and buy a whole new library. We're living in a digital world where most things are available online. And certainly when you start the program via the library services, you will get access to many of the electronic books you need. But where we can, we've identified open source, free access articles that we suggest you might read as well. So that was a long answer to your question, David. Yes, that there is recommended reading or books before the course starts, but I don't know if you want to in the chat area perhaps put in maybe what current wound related journals maybe you access or do you have access to? Perhaps that would be interesting to have a think about because there are journals that are open access that you can access very easily that I can recommend. But even now, starting at looking at some of, the published research in the area in some of the wound related journals, I would say would be good to get your mind into that thinking. So I'm just catching up with the comments. Sorry. A bit of a lag with the comments for
There's
some
a new
reason.
comment there now.
There is there?
Yeah.
If you could see it, maybe you could read it
Yeah.
out, Sean. Mine's
David,
somehow.
that's fine. David said, that's great, thank you. I'd certainly benefit by starting reading any relevant material.
Okay.
So
Okay. Oh, there it is there now. Yeah, well, I could point you to a couple of journals and maybe Sean, because Sean's always very good at finding things when we're talking and typing. There's the Wounds UK journal, if you don't already access that. Um, so they have a quarterly journal. The March issue is out, and that's quite a good journal for accessing anything to do with current clinical practice in terms of research articles, but also quality improvement. There's also more sort of CPD articles in there as well, I would say. So that would be one I'd recommend if you're not accessing that already. It's free. You might just have to log in or set up something. The other one would be the Journal of Wound Management, which is used to be called the UMA Journal, and that's open access as well. And Sean's doing a marvelous job there at finding these links for me. There we go. Um, so Wounds UK also have best practice recommendations. They have consensus statements, and their sister journal, Wounds International, as it says, provides more of an international view of things. That's also free to access, and they have international consensus documents too. Wounds UK also have TVN TV, which is a set of video resources on different topic areas as well. And the Journal of Wound Management, thank you, Sian. There's also the UMA conference, which is an annual conference that comes up. So that's in Bremen in Germany in May of this year. But ahead of that, and I don't know, David, if you're planning to go, there's the Society of Tissue Viability Conference that's in April in Bradford. That's usually a great conference, national conference as well. And Sian, you're attending that, aren't you, and speaking? Do you want to just
giving the
mention?
closing speech.
Oh, do you want to just
Um,
say what your closing speech is?
yeah,
Put
can't
you on
remember
the
the
spot.
title at the moment. I can't remember what we decided on the closing title now. So we are talking about quite a lot of the psychology or biopsychosocial model of uh, wound healing. And we've changed our title several times. I'm trying to remember what it is now off the
Okay,
top of
it's
my
the
head.
general topic area, isn't it? But
Yeah. So, about adherence. Quite often people can be called non-concordant or non-adherent to treatment
non-compliant, yeah,
or
that compliance
non-compliant.
word.
So so we're exploring health belief models and psychology, the theory of psychology around that, and also looking at compassion fatigue in our colleagues.
Mm.
So trying to give some practical advice really in our talk. From burden to balance, that was it.
Okay.
Compassionate wound healing.
Good. Yeah, and that'll feed through into the psychology module as well. That is the first module in year one, which is good. So if I could just go back to UMA for a moment, the UMA conference, as I mentioned, is in Bremen in Germany this year. So I actually sit on the UMA Council and I'm the treasurer of UMA. So I'm delighted to be able to be going to Bremen this year. It's usually a great conference, appreciating that it might be a little bit too far or funds might not allow people to attend. But they do cycle the venue for UMA. Next year it's Helsinki, and then the years after that it'll be sort of mainland Europe, and then hopefully come back to the UK at some point in time. But conference is a good way of keeping up to date as well. Sian and I usually try and attend the Wounds UK conference in Harrogate each year, and that's often a nice place to meet up with students based in the UK who are attending that too. So yeah, I think if there are any conferences that you can attend as well, that's a good way of keeping up with learning and meeting some of the experts in the area too. Okay, so I'm just checking. I say Sian's done a very good job at sharing lots of links in the Q&A area for you if there's anything you want to follow up on. Um, so we've got about 8 minutes left. I just want to check to see if you do have any other questions, you're more than welcome to ask those.
Yeah, I also wanted to point out that there are free places for the Society of Tissue
Hmm,
Viability still.
good point.
If you're working, you're a healthcare professional or residing in the UK, and your primary role is in working in industry, you're not eligible for the free conference. But if you're a health professional and residing in the UK, you can register, sorry. But not if you're working in industry.
Okay. Yeah. Oh, so well worth having a look. Um, so David, do you get to go to any of these conferences? Maybe it'd be nice to know if you have done or are planning to. You're still there. And also, actually, looking where you work, I see you're working in Leeds. I can see that from the login details, David. We do have some current students in year two. One particular student, actually, that's working in Barnsley, who's working in the community. So perhaps if you would want to, I can put you in touch with some current students. I think it's always quite nice to have some local contact, relatively local contacts as well, so that you can sort of speak to them maybe about their experience of the course. Um, Hopefully, in next week's webinar, we might have one of our current students attending that. Unfortunately, nobody could attend today to give their experience, but which was unfortunate. But there we go. But yes, I can certainly put you in touch with graduates, and that's also goes out to the other person on this call who's listening. I'm not sure where you're from. You're more than welcome to pop in the Q&A area where you are if you'd want to, and I can see if we've got somebody local that's a current student or a graduate that I can put in touch with you. Great, David. So you've got some trips planned then, maybe. If you're in Leeds, you can get to Harrogate and Bradford. So yeah, Bradford is next month. So maybe have a look at the link that Sian shared to see if you can maybe get a free place. It's a Wednesday, Thursday, isn't it, Sian?
It
In
is, yeah.
April, 24th, 25th, off the top of my head.
20,
20th, 21st, 22nd,
20,
23rd.
22nd, 23rd, yeah.
Yeah. And Harrogate is normally the second week of November. So yeah, that would be good to see you there if you can make it. Okay, so yeah, so we have 5 minutes left. Please do feel free. I always say that no, people say, oh, well, this might be a silly or stupid question. No, no question is stupid or silly. It's just a question. So please do feel free to ask if you need to.
Shall I put up the UMA courses? I'm not sure I did do that.
Oh, you can
CPD.
do. Yes, so there's some humour modules that are free to access. Yeah, so that's the humour journal, the Journal of Wound Management, which is to say part of that as well. And they often have master classes that they run too. So keep an eye out. You can join, you sign up for the humour newsletter, um, which is worth it, I would say.
Yes, there's quite often webinars, isn't there, to join in on
Yeah,
as
true.
well,
And
lunchtime ones. And
yeah, they're often recorded. So if you're still on the humour site, Sean, there's a resources area. Um, if you were to share the resources link, that's just kind of a library of all resources which you can search and filter. So that would filter the recorded webinars, best practice. Don't have best practice as such, but they have lots of documents that they've been working on. Okay, well, thank you, David. I see you have to go now. Yeah, do email either Sian or myself if you have any queries. Let me pop in my email address um, there, and I'm sure Sian can do the same. So if you do have any queries and you want to ask me, please do get in touch. And David, if you do want to get in touch with your email address, I can put you in touch with the student that's working in Barnsley. So you might want to just be in touch to have a chat about the programme. But otherwise, thank you to those who've joined us today. And I believe the recording will be shown to others. So if you're listening to this recording, then thank you for listening. And please do contact us if you need to. So with that, and thank you, Sian, for being so quick on the finding resources and sharing them. So with
no
that,
problem.
I'll close the event and thank everybody for their attendance. Thank you.
Thank you.